A lot of people are out trying to do the best they can. Every state is so unique, so different. Every country is so different. And we have people all over the world who are trying to figure out, what can cannabis do if I could even get hold of it? What can it do, and how much, and what do I do? And what's the THC versus the CBD? Can you do a real sort of brief, sort of simplified, what is what, and what's even the third element? But talk to us just a tiny bit about these variations that people do want to understand, at least to some extent, if you're going to try to do something. Why is it important to know the language? Because you may not have a medical provider available to you in your dementia world that's going to be very knowledgeable. Some folks are working on it. Some folks are hands off. That's not my ballpark. I don't do that stuff still.
Well, yeah, and healthcare practitioners, they're like staying away from this because it remains a Schedule 1, right? So no medicinal benefits, highly addictive and dangerous, and it's not FDA approved, right? And so the physicians are only trained to discuss FDA approved medicines. So, that's why I formed Holistic Caring, to bridge that gap between conventional and cannabis medicine, to break this down for people. But if we're just to look at the plant and to break down the cannabinoids, there are about 140 of them. So CBD and THC are the two most essential. CBD, they can say, well, THC is no, we need both of them. And they complement and accentuate each other. And my job is to teach people how to balance them out to find their best efficacy. But if we just start with CBD, CBD is descheduled from the Controlled Substance Act. So the 2018 Farm Bill and then subsequent iterations of legislation have removed CBD, which is why it's available in all 50 states. So you can buy CBD just about everywhere, and you should not buy CBD anywhere. There are criteria that give you good CBD, and probably about 70% of the botanical CBD out there is not worthy of buying and using. But CBD is
keep your skin soft. Will it at least keep your skin soft if you apply it?
Well, sure. I mean, even CBD is sold at CVS, but that's not going to help a dementia patient. But what is, if you get a good quality CBD that's well made, that is ethanol extracted, lab tested, organic, whole plant, that CBD is going to give you efficacy. And when I say antioxidant, what does that mean? It rolls through the body, scrubbing free radicals, helping reset things, bringing you back to balance. And it's also a neuroprotectant. Why is neuroprotectant so important for any kind of dementia? Because as we are losing neurodegeneration, imagine the brain shrinking. Imagine the brain losing its connectivity and its nerve cells. And little by little, they're dying off. Well, neuroprotection goes the other way with that. It'll help preserve our nervous cells function. It'll help create new neurons through neurogenesis. It'll help new learning through neuroplasticity. And the neuroprotective antioxidant properties of CBD actually is why the US government took out a patent in 2003. You can Google the US patent on cannabis and cannabinoids, and you'll find that language about the antioxidant neuroprotectant. And so the CBD and the other cannabinoids are extremely fascinating for that. But let's continue on CBD. CBD activates directly about 50 other receptors in our body. The TRPV1 receptors, turning down pain sensitivity and helping balance that out. Mu receptors, helping to work cross-stimulating opiates for people that are on, enabling more effective use. Serotonin receptors. CBD directly agonizes 5-HT receptors, which help you produce more serotonin. What does that do? Gives you the antidepressant benefits, anti-anxiety benefits. So that's why people can take just CBD and calm down. CBD will help with sleep. Small doses of CBD are stimulating, large doses are sedating. So people have to play with when to take it. Is it a morning dose or an evening dose? But this is what I do, help people dial that in. So CBD has so many different ways of protecting and preserving our body and bringing us back to homeostasis. And the last thing that CBD does is it inhibits FAAH, which is the enzyme that breaks down our own endocannabinoids. So we're making these endocannabinoids all the time. You are making cannabinoid compounds in your body right this second. We all are. If we didn't have this, we would die. And CBD helps nourish this system.
Okay, cool. So now THC. the other side of that coin?
So THC is the only part of the cannabinoids that is psychoactive. THC stimulates those CB1 receptors and provides that intoxication. Now, some of that is good. So then we have to talk about dosing, right? So 2 milligrams is amazing for a senior to use in THC, and here's why. It helps with mood, it helps with appetite, it helps with pain. It helps actually, a couple of milligrams are better to enhance cognition, memory. THC can inhibit acetylcholinesterase. So now you have more acetylcholine in your brain, so that helps with memory and cognition. THC is being studied down the road at the Salk Institute for the ability to strip away the beta amyloid plaques. THC is something that's very sedating, so we can use it at night and promote better sleep. THC is, depending on dosing, it's absolutely useful, and I use it with dementia patients all the time. At 1, 2, 3 milligrams, 5 milligrams, eventually as tolerance builds, maybe even up to 10 milligrams. But what people are using for recreation, going back to the brownies you alluded to, that could be a 20, 50 milligram dose that somebody just wants to be intoxicated and feel funny. But that's not clinical practice, right? And so, there's recreational THC and there's clinical medicine THC.
Yeah.
And,
Yeah. So with THC, I'm a little bit more on THC. One of the things that we have found is people who are living with Lewy body dementia, which is a particularly challenging dementia to try to figure out. And there are way many practitioners, medical practitioners and otherwise, who don't really get the prevalence or consistent problems that Lewy body can bring into someone's life. So we have heard from people who are living with Lewy body disease that they really found this is one of the few things they can take that doesn't have really awful side effects or toxicity patterns or problem issues for them. But still, you have to be careful. But still, given that, what are some of the side effects that you might get that are the indication that you're doing this balancing thing and you need to switch the balance a little bit? What are some potential things that people might need to think about or notice to be paying attention to? And I'm sure you talk a lot about that in consults, but just in general, what are some ideas that you want to watch out for? Because it could, for somebody who is sensitive, or if you get too much on board, you might find that you run into some problems that you don't want to have. Balance, I would think, is a potential.
Balance, dizziness, fall protections, right? And so as you initiate care with cannabinoids, you always want to start from a very conservative approach, using high CBD and folding in THC a little bit at a time. So we might start with a 20-to-1, and that's 20 parts CBD, 1 part THC, or a 10-to-1, or even a 4-to-1, 4-to-1, 3-to-1, that kind of ratio, 3 parts CBD, 1 part THC, that's fine to start out with, because even that, the CBD does not allow the THC to be intoxicating. And so the thing is, CBD will partially hog that CB1 receptor so that THC can't lock in like it does if it's unobstructed, right? And so when you give CBD together with THC, now you're able to use THC in very small amounts without having any kind of difficulty. And then you can migrate up. A lot of patients towards the end will be on a 1-to-1 ratio, just equal parts CBD, THC, and then you microdose that about 5 milligrams 3 or 4 times a day, and that's all the meds you need. Slowly we can wean away that Seroquel and the risperidone and some of those things. And when we talk about Lewy body versus vascular dementia versus Alzheimer's dementia and all of these different things, I would never say that cannabinoids are curative or that it could heal it, but what we talk about is symptoms, and let's manage the symptoms. So how can we get somebody to be less anxious and agitated? How can we get them to have better sleep cycles and less sundowning? How can we get them to be more in tune with things rather than checked out and in their own fears? How can we get them to eat and get an appetite back, because a lot of people start losing that and have energy. So, when we talk about this care, it's all about managing symptoms. And then now we can talk about side effects. Like, how do you know when you have just right and when you have an excessive amount, right? Because it's all about the Goldilocks response.
It's about that balance. It's all about the homeostasis.
It's all about homeostasis. And if the endocannabinoid system is all about homeostasis in our body, then we need to nourish this system so that we bring it back into the Goldilocks zone. That's the whole point of this. And so you start with the cannabinoids and then you monitor, like, are we getting dizziness? If we're getting dizziness, that's the first side effect, whether it's CBD or THC. And why are people getting dizzy? First of all, cannabinoids are powerful vasodilators. So for people that are on blood pressure pills, I always want to watch that and also make sure that we're spacing them. So give the blood pressure pill and then an hour or two later, then you can take the CBD. Allow that medicine to work its way out a little bit and then give the CBD. The other thing is hydration. So people need to be more hydrated so that they can, absorb these cannabinoids and flush them through, have them go through the systemic circulation, doing what they need, but not over excessively doing anything. So hydration and taking it with food. Cannabis is lipophilic. That's the other thing. So when you put the CBD oil into the body with a little bit of food, a little slice of banana bread or some avocado in a salad, a healthy fat, that is going to help boost it into the absorption and mitigate any of the side effects of the dizziness as well. So hydration and food is important. The next thing would be dry mouth. That's going to happen. And again, staying hydrated is good. So with CBD, so dry mouth, dizziness, and then the biphasic effects. So you could get a little stimulated at 5 milligrams and a little sedated at 10 or 20 milligrams. So each patient, it has a different endocannabinoid system and needs to find what that sweet spot is for them so that they're just right. So that's really,
and so Elisabeth, with Lewy body, it means that may vary because Lewy bodies get real active and then they get calm and then they get active and then they get calm. And so really working with somebody who knows how to give you the right support and be there in real time with you, being able to make connections and check in makes a difference. So,
and being able to progress through the cannabinoids, because what I do is I have a favorite patient with Lewy body dementia, just no short-term memory, just always needing to be redirected, and was so anxious in the beginning a couple of years ago when we instituted care. But through our progressive management, going from CBD to adding in THC and navigating those guardrails where we need to be based on energy and response and agitation and anxiety, and getting them to be redirected and calm and pleasant. How do you do that? It's a dance, and you use different formulations and you use different products. We use patches, we use topicals, we use CBD THC in different ratios, and then it's not only just even staying just there, but daytime and nighttime dosing. So more CBD during the day, more THC during the night, because we want to get better sleep, because that helps reset things, So, but, the CBD doesn't have much of the guardrails. Generally, that's all about affordability. THC is the other side. So THC, now we can get where you can get increases in a little bit of confusion, or small, again, like I said, small doses are going to be stimulating and improve cognition. A couple of milligrams, too many is going to inhibit them, and what you're going to see then is sedation. And so if you get somebody that's sleeping all the time, or they're really hungry, or they're a little bit too happy and a little bit like just where they're just sitting there smiling, you need to back off a little bit on the THC, right? And so It's a dance.
So you're good at dancing. How about what we can or should or might do with people who are living in residential care? In other words, in nursing homes, in assisted livings, in residential programs where we have medical providers who are outside, but we have nurses or RNs or CNAs or people involved with MedPass. How do you work in those settings? Because then we've got all kinds of hands in the pudding and all kinds of issues. So what are you doing these days in regard to residential program planning?
Well, I cut my teeth and, established all of these programs in home care, right? So where you have people in private homes, it's a lot easier to work and to navigate. But, I do go to assisted living and to nursing facilities, but it becomes very complicated because any of those facilities that are taking federal funds, and almost all of them are, disallow the use of cannabis it's touchy, and it's a case by case thing, because here in California, I'm in San Diego, right? There are facilities that are looking the other way. There are many private ones. A live-in guest home, 30-bed facility, privately owned. They were able to allow me to come on the premises and work with the patients, and the LVNs were passing the tinctures. They were administering this, but because they weren't federally financed, they were able to do this privately, because in California, we have, adult use, we have recreational use, and in a way, we're denying patient rights access to something that they would otherwise have full access if they were not in that facility. But there are a lot of other homes that are skilled nursing, assisted living, hospice, that just will not tolerate it at all. And so, what we need is a federal descheduling, which is part of the MORE Act. I hope it happens in the Biden presidency, but we'll see. It's there's a lot competing right now with COVID and the economy and infrastructure and all of those things. And we thought when Biden came in, it's a Democrat, we're going to get the MORE Act passed. Kamala Harris was one of the sponsors of it, and it's just sitting there. Yeah. But we need to get this, and then of course we need to train all these healthcare professionals, right? Yeah. So my courses through Holistic Caring on the professional certifications, I have complete soup to nuts on how to understand and apply this into healthcare, as well as industry training, and as well as the patient programs like the ones on Alzheimer's and cannabis, and Parkinson's and MS and cannabis, and chronic pain and cancer, and all of these different ways on how to implement cannabis healthcare into practice. But we're a long ways off from there.
Yeah, exactly. And so I think what you offer for people who are aware and in our system is increased awareness, greater knowledge, and the beginning skill of managing what is otherwise often an overwhelming sort of, I don't know what I should do. And the help that people get regarding the other drugs that they take, sort of in the same ballpark. People are not real forthcoming at helping people become self-advocates and monitor and manage themselves much more effectively. And, I know we want to wrap up, but I want to go back to a question, because you sparked a question. So I'm taking some, let's say I'm not actually taking anything, but if I were taking something for hypertension and we started using CBD, and you're starting to notice that, boy, I get a little dizzy. I mean, is the first thing to do something with my CBD, or is the first thing and make sure I'm hydrated? Or is there also this other thing of going, I wonder whether you really need that hypertensive medication at the level you need it, or whether we should start monitoring the blood pressure. And maybe what we need to do is, now that you're not so anxious anymore, now that you're not having this and you're not having that, perhaps you don't need that other medication that has significant side effects. Correct. And it's high cost in many cases, although it might be covered under Medicare in some cases. But looking at it that way, rather than the backing off immediately of the cannabinoids, and instead being smarter about, well, which one has the side effect profile you'd like to sort of deal with a little bit, and why are you taking the hypertensive medication in the first place? So,
and those are so many good questions. Let me unpack a little bit of it. So with respect to interactions with other drugs, right? What I always do when I start a client and their family, they're always together, especially in dementias, is to start this treatment plan looking at all of the pharmaceuticals that are on complete inventory, what they're on, what they're doing, what their dosages is, how long they've been on them, and then what some of those contraindications might be within those meds, and then asking them, one by one, what are the medicines we can reduce? And of course, you need the prescriber on the other side to be in this dance with us, right? Because they're the ones responsible for reducing the medications on their side. But when we start a cannabis program, so that we start with CBD, yes, it can reduce blood pressure. And so we always do them in tandem initially. And then everything goes back to monitoring and tracking. Every single one of the clients that work with Holistic Caring, we give them a tracking log that we use on our follow-up calls. And so 1 to 10, where are we at on levels of pain, anxiety, memory, focus? How easy is it to smile today, joy and mood? And then we're going to check that again in a couple weeks. Energy levels, sleep, blood pressure, blood sugar. Both of them are impacted by CBD. CBD is a vasorelaxant. It's going to lower the blood pressure over time. It's not going to drop it and bottom it out right away. So don't worry about that. But over time, what you're going to see is my blood pressure, and I tell people to monitor it daily. Anybody that's on blood pressure meds and blood sugar meds, both have to be very active in monitoring both of them.
That's that nurse in you. That nursing thing in you will never let that nursing thing go.
No, and because it's all about the patient. I honor and love each one of my patients, and I want to keep them safe. And then having that discussion with the provider, going back to, okay, now we can start whittling these down. I have a client up in Northern California I've been working with for just a couple of months. He was post-stroke a couple of years ago. He developed a tremor. He developed seizures. From that, he developed some high blood pressure. Well, that was the problem in the first place. But he was on 5 different blood pressure and cardiac meds. And now, just in 3 months, we've gotten him down to 2. And the Tegretol has been reduced. And he's sleeping. He's calm. His blood pressure is managed. And he's got energy now. He's out, 78 years old. He's working in his yard. He's happy. He's more productive. And that's what happens when you can start to wean down these pharmaceuticals. So again, you have to monitor everything. And on the blood sugar, for old people with metabolic syndrome and diabetes and prediabetes, when we talk about hemoglobin A1C and some of these other markers, those start to come down. I have an MS client over in Point Loma that we got her off metformin. We got, insulin levels down because what happens with CBD over time is it improves insulin sensitivity. It improves the ability to metabolize and use glucose. So you're not running around with these high blood sugars anymore because, again, it's over time sculpting the body back to homeostasis.
Yeah, cool.
And we're not meant to be on all these pills. And as we can start to wean those down, now we give them back quality of life. But it's a slow process, and you got to be committed on the patient side, on my side as the clinician, and then the other provider in the pharmaceutical side.
Cool. Well, we are very, very happy to know you, and we hope to get to know you better. But thank you for doing this courageous conversation with us. And thanks for opening the door and the window and the light coming in so that people who are very much challenged by dementia and not knowing that much on cannabis, but hearing from others and hearing that there might be something here for me, knowing there's a place to go and find out more. That's just amazing. So Elisabeth, thank you so much.
Thank you very much. It's been an honor and a pleasure to be with you this morning.
Thank you so much. Yay.
Yes.
Hey folks, thanks for watching. Please like and subscribe to help us spread Teepa's positive approach message around the world. And don't forget to click the bell to get notified when new videos are posted.